Have you undergone a breast lift or a breast reduction, and now your breasts are too large? Well, if that applies to you, then in this video, I'll describe to you what we can do to hopefully make it better for you. So let's start by talking about the actual problem. Now, breast lifts and reductions, like any surgical procedure, are not the most accurate operations. I describe to patients that performing breast surgery is not anything like carpentry, where you can measure it by the millimeter and it fits perfectly. With breast surgery, there are things that can affect your results, including swelling that's actually in surgery. Just to give you an example, one of my first breast augmentation patients that I performed years and years and years ago, we decided on implant sizes that were exactly the same size. And when I examined her prior to surgery, her breasts looked exactly the same. Well, when we went to surgery and after I made the breast implant pockets, the breasts looked different sizes. And the one side looked a lot bigger than the other. And so instead of putting in the same size implants like we had planned prior to surgery, I made up for it and put a bigger implant in on the smaller breast. Well, it looked perfect once the surgery was done, and the first several weeks it looked great. But about 3 to 4 months later, she came back, and it was obvious that the breast implant that was smaller, that the breast that had the smaller implant was smaller than the one that had the bigger implant. And so for her, what happened is that there was swelling in surgery that affected how her breast looked. Okay, and so because of that reason, you can actually get swelling during your operation. There is an element of inaccuracy, unfortunately, built into a breast lift and a reduction. And that's one reason why breasts sometimes can be a bit too big afterwards. Other times, people find that after they undergo a breast lift or reduction, the breasts get larger from weight gain. That can definitely happen. And then there's that idea that some patients get spontaneous regrowth of their breast tissue. And what I mean by that is there are patients that I have performed breast reductions on that has spontaneously gained size afterwards. This is extremely unusual, but can definitely occur. The other thing that you want to consider is if one breast has gotten larger and the other one has not, is there a possibility of a mass, like a cancer or something like that, taking up space? So you always want to get your mammograms and your breast exams as normal with your physician. Okay, so if your breasts are too large, though, after undergoing breast lift or breast reduction, then there are some surgical options for us to try to get them down in size. The first option is probably the easiest. It's liposuction. So what we can do is it's a general anesthetic. I make several small incisions into your previous breast lift or reduction scars. I inject the tumescent solution, which is a numbing solution, into your breasts, and then do some liposuction to remove any excess breast fat. That typically can get you a modest reduction in size, and obviously we try to remove the same amount from one side as the other. Typically there's a couple of small incisions. We put a little suture in each of those. We put you in a bra. The surgery itself probably takes about an hour and a half. Afterwards, you go to the recovery room. You're in the recovery room for an hour or so, and then you head home. Typically, most people don't take hardly any pain pills with this. You will swell up a bit. You may actually look for the first few weeks especially that you're either the same size or maybe even bigger than what you started. You can typically start exercising after 2 to 3 weeks, but it will take 4 to 6 months for all the swelling to come down. So what are the risks of doing this? Well, like any surgery, there's risks of bleeding and infection. There's risks of unevenness, of asymmetry, of one side looking different than the other. Also, there is a risk that if you have the type of breast that's really firm, if you're younger, sometimes there's not a lot of fat there, and it's hard to get a whole lot of liposuction. It's hard to liposuction a lot of fat out of it, and you may not get a ton of change. But another risk that you need to be aware of is the potential risk of abnormalities in your mammogram. So what that means basically is that sometimes when you do liposuction and other types of invasive breast operations, it can create calcifications in your breast as it heals. Those calcifications can potentially mimic the calcifications that you can see with breast cancer. Usually good radiologists can tell the difference, but it's possible that there may be a concern, and that may necessitate like a needle biopsy or a breast biopsy to make sure that a calcification is just post-surgical and not cancerous. And that's why liposuction is not something I perform in breast reductions all the time. We really limit it to those situations where it is truly their best option. There are other complications that we can discuss at the time of the preoperative consultation, the preoperative visit and the face-to-face consultation as well. And I also would like you to know that if we're going to liposuction your breasts, liposuctioning does have a tendency to flatten the breasts out. So some people say, well, if you liposuction my breast, will it make it a small, like perfectly circular breast? No. In general, what it does is flatten the breast out, similar to taking an implant out of a breast. Okay, so keep that in mind. It's not the best way to reshape your breasts. If you want to reshape your breasts and get them smaller, then we have to consider doing a revision or a formal breast reduction. Okay, now this is basically going back in. If you've had a reduction before, then basically we reduce you again. It's basically doing the whole surgery again. So how does that work? Well, take a peek at the breast reduction section. My breasts are too large under first-time breast surgery, and that will explain how a breast reduction works. Now, if you've already had one, and this is a consequence that your breasts are too large, and you have a pretty good idea of what that entails. But just as a reminder, feel free to go to that section, the first-time breast surgery, that your breasts are too large, and I will walk you through the procedure of a breast reduction. The recovery basically is going to be the same as with the breast reduction, but the thing is your risks are going to be much higher than the first time. And the main reason why is because at the first time surgery, the surgeon has cut through a lot of the blood supply of your breasts. That's just how the surgery works, is you cut a lot through the breast tissue and you really alter the blood supply. And every surgeon does this a different way. And if, let's say, your blood supply, just for example, let's say you have a plastic surgeon that does a breast lift and the blood supply to the nipple comes from the center of the breast, okay, the middle of the breast. If the next surgeon who does a breast reduction doesn't know that, and they cut that blood supply by basing the blood supply, let's say, off of the bottom of the breast, well, your nipple could turn black and could actually die after surgery. You can have a dead nipple on both sides. So this is very important that if you're going to undergo a revision breast reduction, you have to get your old operative records, and you got to bring them to your revision surgeon. So if you're going to come to see me for a face-to-face consultation, you've had breast lifts or a breast reduction, and your breasts are too large, when you come in the office, I want to see that in your hand, your old operative records, because that's going to tell me where the blood supply comes from and what I can do safely to make your breasts smaller. If you don't have that information, then I may not be able to do a formal revision breast reduction. It may be too risky. So having that information is super, super helpful for us, and it's absolutely necessary at that consultation. Don't leave it at home. If you leave it at home, it means you're going to have to come back and reschedule a second visit for us to go over that. So you want to bring it with you to the face-to-face consultation. If you don't have access to those records, and sometimes even though your ideal situation may be redoing your breast reduction, we may have to do a liposuction-based reduction instead, okay? Just because we don't want to risk your nipple and your areola dying or those types of devastating complications. So I can't emphasize that enough. To redo a breast reduction without your previous records is potentially very hazardous. So we need to get as much information as we can to plan the surgery out the best way possible. So if you have breasts that are too large after undergoing a breast lift or reduction, there are various options. We can either do liposuction or we can do another formal breast reduction. But once again, bring your records with you and we can talk about what would be in your best interest and your best path to breasts that are smaller and that you're happier with. Thank you so much for watching.